Welcome to the glamorous life of a dentist. Spoiler alert, it's not all shiny smiles and minty fresh breath. If you think being a dentist is easy, let me take you behind the curtain. It sucks. Let's take a trip down memory lane. Before you became this, you had dreams. Maybe you wanted to be a doctor, an artist, or even a rock star. But somewhere along the way, someone whispered those seductive words, dentistry is where it's at. And you'll have great hours and make tons of money. What they didn't mention was the price of admission. 4 years of college drowning in pre-med classes. 4 years of dental school where you spend more time studying tooth anatomy than you do sleeping. P.S. Let's not mention the partying. Then there's the small matter of $300,000 plus in student loans. You might think dental school is all about books and drills, but behind the scenes, the love lives of dentists and dental nurses would make Love Island look like a tame Disney movie. And when you finally graduate, that lovely moment when you realize, wait, I'm about to spend my life looking into people's mouths? Oh, and did I mention dental school is brutal? This is what your average day looks like. You wake up before sunrise because, let's be real, sleep is a distant memory. After chugging a coffee so strong it could dissolve your enamel, you grab your backpack and drag yourself to a class. First stop, anatomy lab. Here's where you meet your new best friend, a cadaver. Nothing says good morning like peeling back layers of skin and identifying muscles while trying to ignore the faint, ever-present smell of formaldehyde. Wonderful. From there, it's straight into lectures, biochemistry, pharmacology, oropathology. Name a subject and you're probably cramming it into your brain at lightning speed. Your professors rattle off information like it's a race to the finish. And your notes? They quickly devolve into a mix of squiggly lines and occasional panic-induced doodle. Mandibular nerve equals important? Yeah, you'll figure that out eventually. Or maybe not. By year 3, you finally get to work on real-life people. Well, sort of. Your first real patients are usually your classmates because, let's face it, no one's trusting a rookie dentist with their teeth just yet. It's equal parts terrifying and hilarious as you fumble through your first extractions and fillings. You know it's going to be awkward when you both have to pretend you know what you're doing. But it's all part of the experience, so why not just embrace it? But hey, you finally made it. You're officially a dentist now. Congratulations. Now it's time to face the real horror, your patients. The day starts with Karen. You know Karen. She's here for a quick cleaning session, but she hasn't been to the dentist in 6 years. Her teeth look like a Jenga tower mid-collapse. You gently explain that her gums are inflamed, and she might need some deep cleaning. But Karen's response? Are you sure? My teeth don't hurt. Next up is Bob, the chatty middle-aged guy who insists on giving you a blow-by-blow down low on last night's football game. But here's the fun part. Bob does this while your hands and several sharp tools are in his mouth. Then come the kids. Oh, the kids. Toddlers in a dentist chair are like cats in a bathtub. Terrified, unpredictable, and prone to biting. 1 minute they're screaming, and the next they're running around your office like it's a McDonald's play area. And let's not forget the patients who lie. They look you straight in the eye and say, I brush twice a day, every day. Buddy, your gums are bleeding like a Tarantino movie. Who do you think you're fooling? Honestly, you're a life therapist, a babysitter, and a dental hygienist rolled into one. But at least you get paid to listen to people's life stories while dodging flying saliva. Teeth are nature's cruel joke. They're the only bones that people actively neglect, and it shows. Every day you see things that could haunt a horror movie director. Cavities so deep they should have their own zip code. Plaque so thick that it's been building up since the Obama administration. And that one guy who swears his chipped tooth just happened, but refuses to admit he's been opening beer bottles with it. Then there's the smell. You can wear 2 masks and still feel like you're catching a whiff of something unholy. Bad breath isn't just an occupational inconvenience, it's a biohazard. And let me tell you, it's not always morning coffee breath. Sometimes it's, I forgot what toothpaste is, breath. But teeth aren't just gross, they're also unpredictable. 1 minute you're filling a cavity, and the next you're dodging a surprise sneeze or a reflexive bite. Yes, patients bite. It's like they forget you're a person and think you're just another tool in their mouth. And let's not forget teeth's most infuriating trait, their timing. A root canal emergency always pops up at 4:55 p.m. on a Friday, just as you're ready to head home. Teeth don't care about your plans, your sanity, or the fact that you're running on fumes. They just break, crack, or ache whenever they feel like it. You'd think dentistry would be low pressure compared to, say, brain surgery. But in dentistry, you're always one mistake away from disaster. Accidentally poke the wrong spot? Bleeding gums everywhere. Actual bloodbath. Drill too deep? Congratulations. Say hello to a lawsuit. And heaven forbid you pull the wrong tooth. That's a nightmare no dentist wants to wake up to. And then there's the drama of root canals. Root canals are like defusing a bomb. One wrong move and your patient's in pain and you're the bad guy. But you know what's truly special? Patients blame you for their problems. Yep. The dentist created that juicy hole in your molar. Next question, why is this filling so expensive? Because your tooth is rotting, Brenda. I'm not a magician, just a dentist in this life. If you think the clinical work is bad, wait until you hear about running a dental practice. Insurance companies, they nickel and dime you at every turn. Patients cancel appointments last minute, but guess who's still paying for rent? Utilities and staff salaries in that fancy office. You are. And Yelp reviews? Oh boy, oh Yelp. You could save a patient's tooth from the brink of destruction and read this later. Dr. Smith is great, but I waited 10 minutes in the lobby. 1 star. Because obviously, you control time itself. And then there's the staff drama. Remember those Love Island-style hookups from dental school? Yeah, that energy doesn't stop. The clinic break room is a soap opera waiting to happen. And somehow, you're always the accidental referee. And then, the cherry on top, dealing with the perfect patient who thinks a $1,000 crown should come with a discount just because they smiled politely. No, Brian, dentistry isn't a 2-for-1 deal. Sorry, Bogoff does not apply. There are perks to being a dentist, but let's not pretend they make up for the downsides. Like the free top-of-the-range super electric toothbrushes you bring home, which no one in your family uses because they're too nice. So naturally, you end up gifting them as Christmas presents. That's one way of cutting down the Christmas present budget. Then there are the occasional thank you notes from patients. You fixed my smile, and now I feel confident again. Those moments make it all worth it, until Karen shows up again with her drama. But let's be honest, those compliments are rare. And most people leave your office mumbling about how you stole their money. And let's not forget the endless networking opportunities. Everyone suddenly wants to be your best friend when they chip a tooth at a party. Hey, can you fix this real quick? No big deal, right? After decades of scraping plaque, dodging spit, and enduring Karen's complaints, you might think retirement offers sweet relief. But wait, your own teeth aren't what they used to be. Suddenly, you're on the other side of the chair, listening to another dentist giving you flossing tips. Karma's funny like that. All those years spent lecturing patients on brushing techniques, and now you're the one who forgot to floss this morning and is hoping they don't notice. When you finally hang up your drill, you'd think you'd feel relief. But no, the dental world isn't done with you yet. You'll still dream about the sound of the suction tube. Strangers will still ask you for free advice at family barbecues. And you'll spend all your retirement kitty on massages for that bad back. But at least you're done with the daily grind. However, the memories of Karen, Bob, and the endless sea of cavities, those stay forever. So why does it suck to be a dentist? You're overworked, underappreciated, and constantly dodging lawsuits and saliva. But hey, someone's got to do it, right? At the end of the day, you might hate the job, but at least you're helping people, even if they leave your office complaining about the bill. Now, go ahead, smash that like button and share this video with your dentist friends who could use a laugh or just a hug. Oh, and don't forget to floss.